moving on to management. So aneurysm management. Now, let me tell you a scenario where you have probably, taken a lot of time taking a history, and you just have 2 minutes left. So how are you going to talk about management in 2 minutes? Now, when you start opening your statements to talk about management, ideally, what you should do is you should make sure that you have left a wow impression in the cubicle, even if you did not have sufficient time to finish. Okay. What happens when you leave a wow expression in the inside in the cubicle, and then because the time was up, you still finished, you might still pass. Okay. The most important thing when you talk about what is going on with the child and what are we going to do for this child is characterized by the reassurance that you give the parent. How do you give reassurance? Is you explain the condition and you give advice along with the explanation of the condition. If you do these things together, you would be finishing a major chunk of management by using simple, straightforward words and also leaving that wow effect. Okay. So these days what I see is, even if I quiz someone on the group, please can you define depression for me, I to be honest, I do not get those wow kind of answers anymore. I know that, since I've been running the group for almost a year now, I have seen a lot of replies. Some of them were really those wow factor type replies, and I do not see that anymore. I don't know why. I'm kind of explaining the condition and giving the advice is what is reassurance. So basically, tell the mother what is this condition, why does this child have this, is it serious, and advice is about the diary. So slowly, how can you tell her? So from the information that you have given me, and if the child is there, if you do get examination findings, then you can talk about examination findings. If there is no child, you are not given any examination findings, then you can just come to say, from the information that you have given me, it looks like what your child has is a condition called enuresis. Yes, the term sounds a little difficult, but let me break it down for you. So what it means is the child has involuntary passage of pee during sleep, and it is because they have not yet achieved nighttime dryness, which you yourself know or are aware of, which you yourself know. She already knows, the mother already knows that the child is not dry by night. This condition, it is related to the developmental milestones. It can be a delay in one of those. However, it gets better on its own, and for that, we have some advice for you. Pause. Stop. Ask her. Is there anything you want me to repeat? Do you have any concerns regarding what I have told you just now? If she says no, you can move on. So, your next step is advice. So, what we advise you to do right now is to keep a diary of the symptoms, note down the triggers, and let us know if this child has any symptoms which are suggestive of an infection, like crying while passing the pee. Okay, so that's a child may or may not be able to say that they experience pain while doing something. Okay, some children can, some children cannot. So it's better to say, if you notice that your child is crying or is distressed to pee, please come back to us immediately. Okay, so you have done a major chunk of your management when you have explained this. You have explained the condition, you have told her what is the course of this condition, and you have also said that what we advise you to do, and you have given red flags. So out of those 5 to 6 components of um, aneurysm management, you have given three um, three pointers already. You have ticked off by just saying this. So this um, management that I'm talking about, you can use this when you have 2 minutes left. I guarantee you that this will definitely make a difference in how you present yourself and the scores that you get. Okay, if you have 2 minutes, you can use this. If you have more than 2 minutes, then there are more things that you need to do. You need to give the mother more advice regarding rewarding behavior, moisture sheets, change the sheets. Then sleep hygiene, you need to educate the mother regarding that also, that always encourage your child to empty their bladder or to pee before bedtime. Do not give them any liquids before bedtime. Okay, encourage them to sleep on their own in a separate bed with adequate ventilation and lighting, and keep a reward system, that is, give the child stars whenever they are dry in the night. So the advice continues. If you have more than 2 minutes, the advice continues. You need to say all these things, give red flags, talk about review. When can I see you next? When do I have to see you next, doctor? You can see me after 2 weeks, and please review with the diary so we know how your child is doing. Her next question is, doctor, do you think I need to go to the child specialist with this issue? Now, if you have done a very good job, that is, you have explained the condition very well, said the course of the condition, explained all the components of it, she may not ask you this question. But if she asks you this question, then what she means is that you have not reassured me enough, doctor, so you better tell me more details about this. So my advice over here would be, please give her more details regarding the condition. Okay, I'm not saying that you will fail. Don't think like that. Please do not design or set yourself for failure when you go for an exam. Set yourself for success. Definitely you will pass, you will succeed. Okay, here what we do is we just discuss, okay, in 2 minutes do this, it looks nice. In 4 minutes say all those other things, it looks very, very nice. Okay, so this is about enuresis. There are more depths and details about this, like how to differentiate primary from secondary, what are the daytime symptoms, etc., etc., etc. There are more details. I'm not discussing those details right now because I'm running short of time and I have another scenario to discuss as well. Okay.